Dear listener, loving Sairam to all of you. And I'd like to thank you all to join this very important webinar sessions, which we've been carrying out for the last 3 years. But this time I'm here to just apologize that our last webinar, 7th of March on mindfulness, had some technical hitches and difficulties. So some of the people could not listen some of the program. That's why we decided that this particular topic was so important. We have received so many phone calls, so we decided to repeat it again this time. And I'm sure you will definitely benefit with this such important webinar. And our main speaker, Joyce, has agreed to do it again for all of us. So I thank her and hold the team to reschedule it again. May God bless you all. Sairam.
Jai Sairam. Our monthly webinar today is based on mindfulness and is presented by Joyce Power. Joyce studied psychology and trained as a primary teacher and has been a yoga instructor for 35 years. She has studied various types of yoga masters and continues to do so. Joyce has completed a mindfulness-based cognitive therapy course and trained to teach mindfulness. She has recently completed the Yoga in Health Care Alliance training approved for teaching yoga on NHS Social Prescription Programme. Joyce has taught yoga in various settings ranging from secure unit with mentally ill patients, a drug and alcohol unit, outpatient community mental health centres and in adult education. She has also participated in research on diabetes and back pain as a yoga therapist. Joyce has been a Sai devotee since 1997 and has participated in many Sai activities, including Sathya Sai education in human values in the community and state schools. Currently, Joyce teaches mindful yoga for the Mind charity. Jai Sairam.
Om Shri Sai Ram. Thank you, Dr. Upadhyaya, Priya, and Sri Sathya Sai Baba for giving me this opportunity to share my understanding and experience of mindfulness meditation with you. Though not in the medical field, I have taught mindfulness and yoga to patients with mental health issues in the community, where patients have fed back their experience of mindfulness using terms such as feeling still, calm and blissful. In this presentation, I will talk about what mindfulness is, give a brief history of mindfulness and how it can be applied to almost any activity in our daily lives. So what is mindfulness? According to Thich Nhat Hanh, a Vietnamese Buddhist monk, who I will refer to later, it is the practice of being fully present and alive in the present moment. It is living from moment to moment, being in conscious awareness and living and sensing the present moment. One of the most commonly cited definitions of mindfulness is that of John Kabat-Zinn, that mindfulness is the awareness that arises through paying attention in a particular way, on purpose, in the present moment and non-judgmentally. It is consciously reacting and having control over how we are thinking, feeling, and behaving. At this moment, if you are living in mindfulness, you will be giving your attention to the PowerPoint slide, seeing the slide image, hearing my voice, listening, and experiencing the moment with an open mind, with curiosity, and non-judgmentally. You will be consciously aware of your thoughts, emotions, and reacting consciously. Mindfulness is not a religion, though it has its roots in Hinduism and is a practice more associated with Buddhism. Because in Buddhism, it is considered crucial and is the first step towards spiritual enlightenment. Mindfulness is not being lost in thoughts, usually associated with negative past events or future concerns and worries. It is not being in a stress response state with increased heart rate, respiratory rate, muscular tension, and a stressed out mind with unpleasant feelings. It is not being on automatic pilot or compulsively reacting. Mindfulness has been practiced for thousands of years. It was popularized in the East by religious and spiritual institutions. Thich Nhat Hanh, the Vietnamese Buddhist monk who lived in exile in the West for 39 years and whose quotation I referred to earlier to define mindfulness, has been called the father of mindfulness and is credited with bringing mindfulness to the West. Research on mindfulness meditation in the West began in the 1960s with the growth of Zen Buddhism in America. However, it was not until the late 1970s that mindfulness meditation began to be studied as an intervention to enhance psychological well-being. Mindfulness research began with the work of John Kabat-Zinn, who learned and studied Buddhism under several Buddhist teachers, including Thich Nhat Hanh. In the 1970s, he explored the use of mindfulness for treating patients with chronic pain. He developed an 8-week program now known as Mindfulness-Based Stress Reduction, MBSR, which has been shown to benefit patients with chronic pain, hypertension, heart disease, cancer, and gastrointestinal disorders. Later in 2002, Mindfulness-Based Cognitive Therapy, MBCT, was developed by Siegel, Williams, and Teasdale based on Kabat-Zinn's model and using cognitive therapy to address the prevalence of major depression relapse. MBSR and MBCT are the two most used mindfulness programs, though other mindfulness-based interventions have also been developed. Mindfulness is a holistic program, positively affecting the whole human personality. At the physical level, it helps to relax the physical body, activating the parasympathetic nervous system, which is associated with the relaxation response, reducing physical stress, symptoms such as heart rate, respiratory rate, and muscular tension. At the energy level, mindfulness helps to boost one's energy because it reduces worrying and anxious thoughts, which can trigger off the fight-flight stress response, where energy is lost through mental and physical stress, through muscular tension, increased heart rate, and respiratory rate. Instead, the relaxation response helps to conserve energy. At the mind and emotional level, mindfulness activates the prefrontal neocortex, which weakens neural pathways associated with unpleasant thoughts and strengthens those associated with pleasant thoughts. This results in positive emotions being experienced, and with regular practice of mindfulness, neural pathways associated with a calm nervous system are strengthened. One's default mode of being is to be relaxed, producing thoughts, perceptions, emotions, and reactions more associated with a relaxed nervous system rather than a stressed one. John Kabat-Zinn outlined 7 attitudes to adopt in mindfulness practices. These foundation attitudes have to be applied moment to moment as one cultivates and deepens mindfulness. These are being non-judgmental. During practice, one tends to judge one's performance, and this makes it hard to be content and to find peace. These usually negative judgments can be replaced with neutrality. So, for example, if your mind wanders when practicing meditation, you do not judge yourself as failing or being successful. Being patient. During practices, we need to keep bringing the mind back again and again to the breath and back to sensations of the body, which requires tremendous patience and perseverance. Adopt the beginner's mind. Every time you engage in the meditation practice, you should approach it as if it were your first time. Feel the sensations in your body and contact with the breath. Using your senses, experience the moment, asking of yourself, what is really happening now? Trust. Learn to trust your own experience, feelings, and intuition. It is okay. Non-striving. You should not aim to get something or go somewhere. Do not strain or force a result. Have no expectations. The attitude of non-striving is best understood as not straining or forcing for a result. Again, have no expectations. This, though challenging, can be liberating. Acceptance. In mindfulness, another attitude to adopt is acceptance. It does not mean being passive or resigned. Rather, it is the ability to experience events fully without suppression or excessive preoccupation. You have to accept yourself as you are before you can really change. Attend to your experience with openness and kindness. This is very essential in the practice of meditation. Letting go. Cultivating the attitude of letting go or non-attachment to a positive or negative experience is fundamental to the practice of mindfulness. To be asked to neither hold on to nor to reject an experience is a challenging principle. In the past 30 years, a myriad of mindfulness practices and programs with mindfulness elements have been proposed and practiced. However, there are 4 main mindfulness practice groups. 1. Practices that instruct practitioners to attend to their breath and/or body, strengthen concentration capabilities, and stabilize awareness of somatic and sensory experience. These can be listening to sounds, observing visual, tactile, olfactory or gustatory objects, variations of body scan, mindful running, and certain yoga practices as it occurs in the present moment. 2. As mentioned in the previous slide, the attitude of non-judgmental acceptance is added, and one cultivates an interest and non-reactive stance towards present moment experience. 3. These practices aim to develop wholesome and pro-social emotions, thoughts, and behaviors, including kindness, compassion, and appreciation, such as loving kindness meditation, compassion meditation, and gratitude practices. 4. In mindfulness, one takes apart subjective experience into its various components: attention, sensation, feelings, cognition, and perception, and observes the interplay between them. As the ability to deconstruct experience develops, automatic reactivity further weakens and distorted perceptions, misconceptions, and biases that underlie craving, avoiding, and rejecting, leading to mental distress, are deconditioned. For example, if you wave to a friend across the street and are not met with a wave, you may assume you have upset the friend, when in fact they have just not seen you. In being mindful, you would develop a non-judgmental response and act accordingly. Our body is where all the thoughts, emotions, and action take place, and we have within us the tools to engage in the process of mindfulness using these. We have our bodies, a tool to focus on as we engage in a mindful activity. We have the breath, the most important tool in mindfulness, as it helps us to stay anchored in the present moment. We have the ability to attend to or concentrate on the activity we are engaged in. Remember, the more we concentrate on an activity with a relaxed, neutral, or pleasant thought, the better. Better than focusing on a past unpleasant event or worrying about the future. This will only strengthen a neural pathway which arouses the stress response rather than the relaxation response of a pleasant or neutral thought. And finally, we have the senses, the eyes, the ears, the sense of touch, smell, and taste to fully experience the moment. The human brain is a complex network of neural and synaptic connectivity. Our brain is working about 90% of the time beneath conscious awareness, and so most of the time we are not aware of how we are thinking, feeling, and acting in the moment. Instead of being fully present, we tend to be engaged in thoughts related to a past event or the future. We are on an automatic pilot, like when driving a car, thinking, feeling, and doing things that we have learned repeatedly in the past and stored in our memory, in the old brain, the amygdala. Unfortunately, the thoughts we have stored tend to be negative in nature. Over time, with repeated attention being given to these negative thoughts, we strengthen neural pathways associated with them and related stress responses. In turn, this negatively affects the state of our mental and physical health. On the other hand, if we engage in mindfulness, we activate a relaxation response. Mindfulness also activates part of the brain which awakens conscious awareness so that we can control our thoughts, feelings, and act consciously. The more we practice mindfulness, the relaxation responses associated with it become stronger and replace the negative stress responses associated with negative thinking. This results in an improvement of our physical and mental well-being. Research has shown the positive benefits of mindfulness on the physical body. Initial randomized controlled trials in this area suggest that mindfulness interventions can improve pain management outcomes among chronic pain populations. And there is preliminary evidence for mindfulness interventions improving specific stress-related disease outcomes in some patient populations. There has been a surge of interest in how mindfulness meditation improves health and well-being. The following are just some of the benefits of mindfulness. A review of mindfulness-based interventions for young offenders in 2017 have reported participants feeling less stressed, better able to concentrate, managing emotions and behavior, and improve social skills. Mindfulness-based interventions appear to have psychological benefits, reducing depression, anxiety, and distress symptoms across several studies. There is moderate evidence that mindfulness-based interventions, such as meditation, yoga, and stress reduction, lower the perception of pain, increased mobility, improve functioning, and well-being. These results demonstrate early provision of MBSR for women newly diagnosed with breast cancer provides not only psychological benefits, but also optimizes immune function supportive of cancer control. Mindfulness is one of the most popular psychotherapeutic techniques that helps to promote good mental and physical health. Despite the fact that research on mindfulness meditation started in the 1960s, it was not until the late 1970s that mindfulness meditation began to be studied as an intervention to enhance psychological well-being. Since then, mindful practices have been applied in various settings as shown here. Mindfulness is an inward journey to a state of health and well-being. Since our physical and mental well-being is experienced within us, in mindfulness we can enhance it by going inwards on a journey using different parts of the body, sensing, feeling, and using tools we possess. Ultimately, with regular practice, it will influence our physical and mental well-being in a positive way. No doubt, we sometimes have to go outwards of ourselves to effect changes in our well-being, as when we take medication or when we engage in activities to improve and maintain good health. These activities may include yoga, the gym, swimming, walking, dieting, etc., all of which, if applied mindfully, can further enhance our mental and physical health.
In step 1 of the breathing space, becoming aware of the present moment in its fullness. By deliberately adopting an erect and dignified posture, whether sitting or standing, allowing your eyes to close if that is possible or appropriate in this moment, otherwise keeping them open. And in either case, resting in an awareness of your inner experience, opening to it and asking, what is my experience right now? What thoughts are going through the mind? As best you can, noting thoughts as mental events, perhaps even becoming aware of their content in words. What feelings are here? Turning towards and opening to any sense of emotional discomfort or unpleasant feelings. What body sensations are here right now? Perhaps quickly scanning the body to pick up on any sensations of tightness or bracing. Now in step 2, gathering and redirecting your attention to focus on the physical sensations of the breath, just breathing itself. Moving in close to the sense of the breath in the belly, feeling the sensations in the abdominal wall as it expands with each in-breath and falls back with each out-breath. With full awareness following the breath all the way in and all the way out, using the breathing itself to anchor you in the present moment. And now, in step 3, expanding the field of awareness around your breathing so that, in addition to the sensations of the breath, it includes a sense of the body as a whole, your posture and your facial expression, how they feel from the inside. If you become aware of any sensations of discomfort, tension, or resistance, experimenting gently with breathing into them on the in-breath and breathing out from them on the out-breath, perhaps feeling a softening and releasing with each out-breath. If you care to, perhaps saying to yourself on the out-breath, it's already here. Whatever it is, it's already here. Let me feel it. And now, as best you can, bringing this expanded, more spacious and accepting awareness to the next moments of your day, whatever circumstances you find yourself in, as it continues to unfold.
In conclusion, mindfulness is a moment-by-moment awareness of thoughts, feelings, bodily sensation and surrounding environment. Mindfulness-based interventions are effective for many common mental, physical, and social health conditions among different populations. Studies have suggested that the mechanisms of MBIs include changes in mindfulness, rumination, worry, self-regulation, compassion, or meta-awareness. Beneficial effects of MBIs have been found in many health conditions, cancer-related symptoms, and pro-social behaviors. It has been found to be beneficial in healthcare, schools, and workplace settings. However, non-compliance is a barrier to learning mindfulness, and research shows that the dropout rate can reach 25% or higher. Despite the increasing trend of mindfulness studies and applications, there are still many areas that need exploration. There have been some inconclusive outcomes or unclear effectiveness. More high-quality studies with adequate sample size and longer follow-up duration are needed. If you wish to learn more about mindfulness, here is a list of some reading. Thank you for listening. Om Shri Sai Ram. We are now going to engage in an activity called diaphragmatic breathing. It is a breathing exercise involving the diaphragm, a dome-shaped muscle just below the lungs, and which allows the lungs to breathe to their full capacity. Diaphragmatic breathing also helps one to relax and reduces anxiety, helping reduce blood pressure and heart rate. It also helps to increase oxygen levels in the blood.
We are now going to work on the diaphragm. Sit on a chair with your spine upright or on the floor cross-legged. You can have your eyes closed or have them opened, focusing your gaze downwards without lowering your head. And now slowly bring your hands to the abdominal area, placing the palms flat against the abdomen, on the navel and above. And then just observe yourself breathing in and out, and notice any movement in the abdomen as you do so. Taking deep breaths. You may notice slight movement with the abdomen expanding as you breathe in, with the abdomen contracting as you breathe out. That is if you're breathing correctly. Or you may feel no movement at all. It doesn't matter. We're going to engage the diaphragm by creating the movement, breathing in as we expand the abdomen, breathing out as we contract. In as we expand, out as we draw in the abdomen. In as we expand, out as we draw in the abdomen. Now we're going to add the words Sai Ram to the breathing, or I am peace. As you breathe in, you're going to say Sai. As you breathe out, you're going to say Ram, and do that mentally. Or you can say, I am on the inhalation, peace on the exhalation. As you breathe in, feel energized. As you breathe out, imagine the energy spreading in through the body. So for example, as you breathe in Sai, feel energized. Ram, feel the energy spreading through the inside of the body. I'm expanding the abdomen. Peace, spreading the peace energy through the body as you breathe out. So do that twice more in your own time, focusing on the inside of the body, feeling the expansion, feeling the contraction, feeling your breath. Hearing the sound of your breath. Hearing the word Sai Ram or I am peace. Feeling the movement in the abdomen. Twice more. And you can open your eyes.
Sairam, so thank you so much to Sister Joyce for such a wonderful presentation and for reminding us of why mindfulness is so important in our daily life. And now we're going to go through a few questions. So the first one that's been put through to us is there any medical evidence or studies to show an improvement in diabetes, asthma, and heart disease with regards to mindfulness?
Yeah, thank you. And I'll just start off by talking about asthma. Mindfulness research with asthma is rather limited, but it supports the potential of mindfulness in reducing the need for pharmacological treatment. It also shows that mindfulness helps with the reduction of acute asthmatic episodes and visits to emergency departments and hospitalization. With diabetic research, mindfulness has been shown to be effective together with yoga more than any other of the other mindfulness practices. And that perhaps is because of the exercise part of the yoga. And it has been shown to reduce blood sugar levels in type 2 diabetes. With heart disease, the research is conflicting, and it isn't very clear, and because there have been problems with studies and they haven't been very well controlled. However, it has been shown that heart rate is substantially decreased and that this contributes to the management and prevention of heart disease. I will quote one study here from the European Journal of Preventative Cardiology, which showed the effect of mindfulness on heart rate variability. And this was shown to be very successful. There were 27 healthy adults participating in the study, and they engaged in mindfulness. And during meditation, it was found that heart rate variability parameters improved considerably, helping to reduce the risk of cardiovascular disease. In any case, all three conditions are exacerbated or can be triggered off by stress, and mindfulness has been found to be very effective in reducing stress. So it is very good in helping with managing and preventing these three conditions.
Perfect, thank you. And so holistic as well. So it's something that perhaps we should all be doing as preventative strategy too.
Yes, it's very good because stress exacerbates and triggers off so many conditions where there's a predisposition to take on those illnesses.
Amazing, thank you. So we've had a question to ask that some schools are actually using mindfulness in their classrooms. In your experience, does this work?
Oh yes, it certainly does work. It doesn't necessarily mean the mindfulness meditation. I haven't had experience teaching mindfulness meditation in schools, but I have had experience of observing other forms of meditation being taught at schools. The research with mindfulness being used in schools is rather limited, and it's not as much as has been done with the adults. However, the results have been encouraging and have been shown to mild to moderately impact on various indicators, such as those that affect positive mental health, social and physical well-being. It's also been shown to have, again, mild to moderate impact on learning, and with improved concentration levels and with improved academic grades. In terms of affecting behavior, mindfulness has been shown to, again, with mild to moderate impact, to have an effect on aggressive behavior and the compulsive behavior that's associated with ADHD. I have been lucky to be teaching meditation, at least in one school and in holiday schools, in state schools. That's 5-day events. But in 2 schools where they've been practicing it every day during the term time, there have been amazing results. I've seen one school where they've used a light meditation with values, and I've seen the children so happy in the school, not just the children, the staff as well, and academic grades improve. In another school that I actually worked in, where there was meditation practiced every day, but in a more stricter environment. We had a visit from a psychologist who came to assess one of the children for ADHD, and she said that she couldn't see any signs of ADHD or focusing problems within the school. And she had been to several schools, other state schools, and she said that this was quite amazing. But I personally have seen children's confidence grow, and I've seen academic results improve and concentration skills. But the confidence, especially with children, some children with special needs, when outside the school environment, to see them confidently ask questions and communicate with people outside, that's been quite impressive.
Amazing.
Yes, there has been, however, a long-term project called the Myriad Project, which was done with teenagers, and that was done over 8 years. And in this country, with over 28,000 teenagers. Unfortunately, the results weren't significant, and that was because the teenagers found it quite boring, and they found it difficult to practice at home. They participated in a 10-week programs, at least one 10-week program each, and it was found that they found it difficult to practice at home. And the one session that they did attend a week didn't suffice to get the results that they were expecting. So there was a recommendation that the teenagers should be involved in the design of the program, and also the teachers who delivered the program should be practicing and trained properly. So that was a long-term project, but it was a long-term project, but with students only participating for 10 weeks and once a week, and that didn't suffice.
It's so nice to hear all of your first-hand experiences as well. And we're very blessed to hear those. So thank you for sharing. So we've had a question from somebody that says that when they try to meditate, they find that their mind has trouble focusing. Any sort of tips or tricks that you've got for us?
In mindfulness, as I said in the PowerPoint, one of the attitudes we need to adopt is that of non-striving. So you don't try hard to focus, because the harder you try to focus, the less or chance you get of getting rid of that thought. So it's best to acknowledge the presence of a thought, an interfering thought. And you can say something like that, something like, if the thought comes to mind, in interrupting your focusing, you can say thought, acknowledging its presence, and then immediately come back to your breath, because your breath is what focuses, what anchors you in the present moment. And you can continue focusing on your breath until such time as your mind wanders again, and then you keep disciplining the mind to come back to the breath, but not trying too hard to force these interrupting thoughts away. Just return back to the breath at a point where you feel the breath most pronounced, either in your nostrils or in your abdomen. It is important that you experience the moment without judgment and without expectation of an end result. You don't have to get your mind clear. It's okay for thoughts to come into your mind. That is okay. Just be in the moment and accept those interruptions, but use your breath to help you anchor back into the present moment.
Perfect. Thank you. And that actually leads us very nicely onto the next question, which is it just the breath that we focus on, and how can we be mindful when communicating or speaking?
Okay, we can be focusing on anything, any activity. We can be focusing on body sensations during the body scan, and of course the breath, but we use the breath to bring us back into the present moment. It's the breath that actually anchors us in the present moment. So we can be focusing on anything. If we're focusing on communicating or speaking, then we need to activate the sense of hearing and our speech. And also we need to be aware of the breath, because it will anchor us in the moment. But and it's not easy to be able to communicate very well or be a good listener. So we need to practice and practice and practice until it heightens our awareness and we're more aware of how we are communicating with others. So it's just practice that needs to be done. With listening and other skills as well, practicing heightening awareness through activating, say, for example, if you're walking, feeling the steps, your feet touching the ground, so that you're just beginning to get into this practice of being in the present moment. But then you've got the breath, of course, to help you come back into the present moment.
Yeah, those practical tips and examples are really helpful, actually. Thank you. So if we start right now and say today's the day that we're going to start mindfulness or meditation, how long does it generally take to see a change?
According to the research, it takes 8 weeks if you're attending a course. So you attend once a week for 8 weeks, but you're expected to engage in practices every day at home. And it varies between individuals. It doesn't mean that within the 8 weeks your problems will disappear. However, it means you will begin to see some effect on your health. You will feel better. Your moods will change, but it doesn't mean that your problems will go away. So you need to continue to practice after that. But initially, for the first 8 weeks, you need to be practicing every day. Now, that is if you want to reduce your stress levels. However, if you want to see change, real changes, in terms of if you want to engage and use mindfulness for spiritual enlightenment, it will take longer. And it's a totally different way of doing it as well. So I can get an effect, or most teachers who teach mindfulness will get an effect within the hour of focusing on the breath and engaging in various activities. And the benefits of the hour will last for about a couple of hours in terms of stress reduction. But then you have to keep practicing. And if you want to sustain the results of that 1 hour's meditation, then you need to engage in applying mindfulness principles to other activities that you are engaging in during the course of the day, whether it's washing dishes, whether it's eating, walking. If you're applying mindfulness principles to that, then you sustain the benefits of the 1 hour where you focus on a complete meditation.
Right. It's almost like it becomes a way of life.
Yes, it does. And it involves a lot of practice. And it does work. I've seen it work for myself. And that's one reason I teach it, because it means I have to practice myself.
Thank you. So in mindfulness, sometimes some days are easier than others. So some days it's easy to focus, and other days, the mind drifts. Is there any suggestions as how to stop this from happening?
Well, the nature of the mind and your state of being is different from moment to moment. So your experience of mindfulness will be different from moment to moment as well. And there will be days when you can focus better on some days than on other days. In my experience, I've found that what happens before you come to the mindfulness practice, before you come to it, can influence how you focus. If you've had a very stressful day, then it's harder to get into the focusing mode. Also, if recent events before your mindfulness practice have involved extreme emotions, then it's also difficult to focus. However, you keep bringing your mind back to the practice, you tune into the breath, and you engage in watching your breathing. And also with engaging in other activities during the course of the day, it helps you to focus better. And it's only practice that brings that. Just disciplining the mind to come back and back without striving. It's a knack of doing it by accepting the moment and just gently bringing your mind back to focusing on breath. And of course, engaging in other activities mindfully facilitates progress.
Amazing. There's lots of repetition here, isn't there? Like just keep on coming back, focusing on there's some very easy principles actually that you can just put into your everyday life. I know it sounds much easier said than done, but again, it's just keep repeating that mantra in your head.
And it's not an exciting practice to engage it. It can be very boring. And in fact, in yoga, for example, it's the last stages of your practice. You start off with exercises and breathing, and then relaxation, then withdrawal of the senses, which is and then concentration, and then meditation. Whereas in mindfulness, you go straight into meditation. So many people, unless the teacher teaching it has got a lot of experience of meditation, it's very difficult to explain to people the benefits of it, because it is a boring technique. It's not an exciting technique, unfortunately.
Amazing. So is mindfulness a pre-meditative state?
Well, mindfulness is both a pre-meditative state and a meditative state, because in the pre-meditative state and meditative state, you're following the same technique, only the experience changes. Thich Nhat Hanh, who is the founder of mindfulness in the West, he says there are 3 stages in the mindfulness process. There's the first stage where you consciously bring your attention to your breath and you're mindful of that present moment. And he says in that moment you are activating the mindful energy. Then you're staying focused on that one thing that you're focusing on. In this case, it would probably be your breath, or it could be anything else that you're focusing on, but largely on your breath. And it varies from individual to individual. For some people, it may take a lot of effort. And we're not supposed to strive, but it does take a lot of effort, the discipline of bringing the mind back to the practice. And during that concentration phase, he says that you generate a concentration energy. Now, if you're just doing mindfulness for its health benefits, then you might be in the pre-meditative state. But if you want to use it to go on a journey of spiritual enlightenment, then it will take much longer, and it also involves a lot of disciplinary practices, and you might have to go on a diet. You might have to do it on an empty stomach in the early hours of the morning with different practices, if your aim is to achieve spiritual enlightenment. So it is both a meditative and a pre-meditative state. It has been used for meditation, for spiritual enlightenment for over 2,500 years. So it's always been a meditation. But if you continue to practice after you've done the 8-week course over a period of time, some people might begin to see changes in themselves. Also, the point at which you transcend your physical mind and go to a different plane of consciousness, that's when you arrive at a state of deep peace, and that is a deep meditative state where you also transcend the mind and connect with true knowledge, where you, in fact, you find all the great enlightened masters, they all have got to that state, and they all come with the same answers. So truth is truth, and it doesn't change. But as normal beings, we go back into that normal mode where our perceptions are influenced by the way we've been brought up, by education, and it can be a tainted perception. So it varies from individual to individual. It depends where you are on your journey to enlightenment, but it changes you as a person anyway. So people who practice mindfulness for a long time, they become more compassionate, and they also, in fact, you can become a Nelson Mandela or Mother Teresa, where you display, traits of universal love and compassion, forgiveness. So that is like the ultimate. But for health benefits, you don't need that long a time. But it can help you, prevent you from getting illnesses that you have a predisposition towards. Can I just say that not everyone should engage in meditation straight away. Especially those who have serious mental health issues like psychotic episodes or schizophrenia. It wouldn't be wise to go straight into meditation. It's best to work on practices like the physical practices, which help reduce the stress that's associated with the illness. But it's more a preventative measure, and it helps you manage your condition and reduce stress levels associated with any illness.
Incredible, amazing. Actually, reminded me, I did an 8-week course myself. Actually, it was a self kind of help book and a CD, and actually really inspired me to perhaps revisit things, because you're right. I think you have to do this day in, day out, because
Yes.
you notice the change at the time, but it's that continuity that's so important.
Yes, so it's good to join a group, because if you have a group and an experienced teacher, they will generate a certain energy, and the transference of that energy within the group will help facilitate progress. And of course, if you're very lucky, if you meet an enlightened master, it's even better, because progress will be faster in terms of changing as a person and being interconnected with everything around you.
Thank you. Our final question, kind of related to the previous question, is mindfulness different to meditation?
No, because mindfulness has always been a meditation technique. But as I said earlier, the experience of meditation and concentration, and there are different stages to meditation. So it is a meditation, but the longer you practice it, and in the right conditions, the meditative state is one where you transcend your mind and go into a different space of consciousness, a higher consciousness. So mindfulness is meditation, but there are different stages to it. And depending where you are and how long you've been doing it for, and where on the spiritual path you are, everyone will be different. And yes, it is a meditation, and it's a crucial to, it's the starting point of Buddhism, meditation towards seeking enlightenment.
Perfect. Thank you so much. Firstly to Swami for inspiring such a wonderful talk and bringing Sister Joyce into our lives today and on our screens. Thank you to Dr. Upadhyaya also. Thank you so much for listening. Sai Ram.